Good afternoon, respected judges. The topic for my presentation is the silent assassin, the endogenous fungus endophthalmitis and the COVID-19 era. And I give a few case series. Now, what is endogenous endophthalmitis? It occurs due to generalized infection or hematogenous seeding of fungal pathogens. It constitutes 35 to 65% of all cases. Now, the COVID-19 pandemic led to widespread use of systemic steroids along with the various ocular associations. And it is due to the direct result or the cytopathological effects, the adverse effects of pharmacologic therapy. It may be due to prolonged hospitalization or alterations in the host immune response. Now, our first case was a 61-year-old lady who complained of dimness of vision and was on systemic steroids. In imaging, we obtained the double target sign, which was characteristic of liver abscess, and choroidal abscess was found inferotemporal to the macula. Our second case, we got string of pearls appearance. In our third case, we got a 64-year-old male complaining of floaters, and no fungal biopsy was not confirmatory, and it was a presumed case of endogenous fungus endophthalmitis and was responsive to oral ketoconazole, itraconazole. In our next case, which was also a case of RT-PCR confirmed COVID-19, we've got systemic evaluation revealed right hydronephrosis, and vitreous tap was positive for septate hyphae of Aspergillus fumigatus, as shown here. Now, our next case, we could not see anything. There was dense vitritis and a yellow-white lesion about half disc diameter inferiorly. We proceeded for pars plana vitrectomy and got Cryptococcus neoformans. In our next case, we got a well-defined oval yellow-white lesion in the left eye of macula. Here also, we opted for pars plana vitrectomy, and fungal culture confirmed Candida albicans. In the next case was a 50-year-old female who was complaining of pulmonary hypertension developed after hospital stay, and HRCT thorax was suggestive of fungal infection, which was confirmed on bronchoalveolar lavage fluid. In the next case, we also obtained mild vitritis with fluffy snowballs. Vitreous tap was negative. Our next case was almost the similar finding with vitreous microscopy showing Aspergillus flavus on Sabarus dextrose agar culture. And final case was a yellowish preretinal lesion suggestive of invasive fungal keratitis. Now, this was the detailed data of our patients starting from duration to presentation. Now, coming to the discussion part, identification of systemic focus is of prior importance in these cases, with many new recent inventions coming to the fore. Higher preponderance of male patients was seen in our study, with our mean age presentation being 57.4 years. Diabetic-related systemic complications was the most common background. In our study, lungs was the most common primary site of infection, and all our cases had RT-PCR confirmed COVID-19. Now, there is a low yield in vitreous tap and culture, and so they need to have a high index of clinical suspicion in at-risk patients with prompt initiation of medical or surgical therapy, which may improve the clinical outcome. It depends on the various factors being causative organism, the severity of involvement of the ocular chambers, and follow-up. Now, I would like to conclude by saying that though a rare presentation, it can have a devastating effect of vision, particularly because the presentation is silent. Now, thank you everybody, welcome.
Dr. Subhajit, you had 10 cases
yes,
of fungal ophthalmitis.
Yes, ma'am. Yes.
So could you compute what is the risk factors in these patients?
Ma'am, the risk.
Diabetes is there for now.
Yes, ma'am.
COVID.
During the COVID-19 era, there was a huge rate of steroid use, systemic steroid use, particularly.
These 10 patients.
Yes, ma'am. In these patients, there was, in 40% of cases, we had a history of indwelling catheters. After admission, catheter use.
Actually list the risk factors which these patients had.
Yes, ma'am, because shortage of.